mission of the ARC, many of you know already, is to enhance the lives of people with disabilities, intellectual and developmental disabilities, including autism and their families. And we fulfill this through advocacy for community supports and services that foster social inclusion, self-determination, and equity across all aspects of society. I'm going to raise the volume a little bit more. Okay, and today's next slide, please. Today's piece, we're going to do an overview of the workforce shortage crisis, and then Ellen's going to take over parts 2 and 3 about the fix, and then what the legislature and administration can do, what's proposed, and then how you can make a difference in advocacy. So if we could start, keep moving onto the next slide, which is a great picture, and we're going to give you an overview of the crisis. And this presentation is more of a legislative update. So we will briefly review the workforce crisis and then shift to those other 2 parts. So if we could go on to the next page, you can see that through the Mass Council of Human Services and Donahue Institute and the ARC of the United States and University of Minnesota, we have 2 different sets of data. The first, basically 72% mass human service providers say it's been increasingly difficult to hire over the past 3 years. And then you see that 6 in 10 participants of the report noted, over half noted that they cut back their hours. Over 30% turned down career opportunities. So pretty serious limitations, whether you're a caregiver or even a person with disability hiring someone or a provider trying to serve people. Next slide, Carrie. So basically, this gives you a sense. We're going to use the word DSP. That's for direct support professional. You can see that 92% of caregivers had difficulty finding a direct support professional in the FIND survey. And the annual turnover rate is an estimated 46% within a year of employment. And then next slide, we continue to have a low unemployment rate in Massachusetts. Next slide, please. Yeah, at 3.3%. And on top of that, Massachusetts is the 3rd highest costly state to live in. Pretty astounding. And some of our salaries are still pretty close to minimum wage, and you'd have to work 84 hours a week to afford a 1-bedroom apartment, according to the Housing Task Force. Next slide. This bill and our effort proposal is really about addressing the entire scope, whether it's an individual with disability, caregiver, family or neighbor, provider, public sector authority hiring people, whether it's through the Department of Developmental Services or Mass Health. So it cuts across both sectors and many types of services, our proposal. Carrie, you could go. And you know, all of you on the phone, the video know this, that the DSP staff has such important roles to play, whether it's the everyday roles of activities daily living, which is so important, you know, or it's helping employment assistance or building bridges to community, or just plain ensuring safety. Next slide, Carrie, please. And again, one of the things that we've talked about before is just the mean wages, which we pulled out of 2017 Bureau of Labor Statistics. Just the nannies and janitors, custodians, all reflect favorably to our staff, but we want staff to be in there for the long term and be committed and value their work with people with disabilities and families. Ellen?
Okay, I'm going to go over some of the proposed fixes by the legislature and the administration. So in December of last year, we put forth a proposal to tackle the direct support workforce crisis, and we presented it to the administration and the legislature. So this slide just lays out our 4-point proposal. If you want to take a look at our proposal, it's a long report. It's on our website, and we'll give you the exact web page later on. But it lays out all of the strategies for us moving forward. And today we're just going to focus on part 1 of our proposal, which is the workforce investment. And So that's the next slide. We need significant investment over the next few years to achieve entry and mean level salaries and improve benefits to recruit and retain a stronger, more qualified workforce. We hope to gear the compensation to what is paid in the health and education sectors. So in addition to having significant gaps in the recruitment of staffing at people's homes and agencies, we estimate there's a cost of about $19 million due to turnover costs. So we really need to address the turnover issue and the gaps in staffing that exist. So next slide, we, as a part of our workforce investment strategy, we worked with Representative Garlick and Senator Feingold's offices to introduce a bill to address the workforce crisis. So this session, Representative Garlick and Senator Feingold filed House Docket 1130. And after taking some time to review by House Legislative Counsel, the language of the bill was revised, and in accordance with House rules, we have the updated language now, and there is another opportunity for co-sponsors. And so that's what Leo mentioned earlier. The deadline for co-sponsors for HT 1130 is today, May 20th. So we now see the language, and we know that the bill establishes rate-setting requirements for all human service providers, inclusive of state purchases of services contracts and mass health state plan supports and services. As of this morning, we have 70 co-sponsors. You can see if your legislator is signed on by checking the Massachusetts legislator website. The bill requires a minimum of $17 an hour wage for entry-level direct care support staff of a human services provider, which will be reviewed by the commissioner or secretary every 2 years with a goal of achieving $24 an hour by 2025. So, next slide. There will be a determination of wage rate calculations for all human services workers by using current marketplace costs and other related data, but this excludes executive level staff. The bill also addresses loopholes that dilute personnel salaries. This could include human services providers' fringe rate calculations, will incorporate fringe benefits, payroll taxes, and any present or future government promulgated employer mandates, which could include, but it's not limited to, healthcare premiums, FMLA costs, payroll taxes, employer medical assistance contributions, employee fingerprinting, and other required costs. The bill also sets up a long-term state plan by the Executive Office of Health and Human Services, and this will be developed within 8 months of enactment of the bill. And it also establishes enforcement mechanisms for any violations of the bill. We should know by this week what committee the bill will be in. It could be in the Committee on Labor and Workforce Development, or Committee on Children, Family, and Persons with Disabilities, or the Healthcare Finance Committee. We don't know yet, but we will find out soon. And we assume there will be a hearing set to discuss the bill, and we'll definitely need a lot of help recruiting families and workers to testify at the hearing. Next slide. So in addition, we believe that, according to the bill, we've set up that there should be a process to develop a long-term action plan to address the crisis. I think we skipped a slide though, sorry. There you go, other relevant bills. So on our platform, we support other bills to curb the workforce shortage crisis. We just want to go over them quickly. So that's House Bill 138, Senate Bill 1077, which seeks to have staff at private providers be the same as those in state-operated programs in the same fields. And then we also support the loan repayment bill, which is Senate Bill 56, House Bill 163, 11.3, and that encourages direct care workers to enter and continue working community-based human services programs, and it would provide a loan reimbursement up to $1,800 per year. And we will be testifying at the committee hearing to review these two bills on May 28th at 10 a.m. at the State House. Which we just wanted to let you know that we support these bills as well, but our number one priority on our legislative platform is the workforce bill, HG 1130. So next slide. So as I mentioned before, Health and Human Services must adopt a process to develop a specific long-term plan to address the crisis. And this is a picture of Secretary Setters, and she has stated publicly that the administration recognizes that there's a problem for recruiting and retaining direct support workers and is committed to working with the ARC and other stakeholders on a long-term solution. So next slide. You guys may recognize who the people in the picture. We've got Donna Jay from the North Shore, who's a well-known SALT advocate in our community, and of course Carrie Mahoney, who's our Director of Education and Outreach, and this was taken at this year's legislative reception. So how can you make a difference? What is advocacy? We believe the ARC advocacy is clearly communicating an issue or cause to educate or persuade change. The ARC focuses on providing a consistent series of communications to educate and inform our elected officials for better community supports and services that foster social inclusion, self-determination, and equity. So what you see in this picture, we have a picture of Representative Steve Hay, and these are individuals from the ARC of Opportunity at the State House, ready to advocate for change. The next few slides, because we're running out of time, I'm not going to go over, but they basically describe our current leadership in the Massachusetts legislature, which you can go over later. If you have questions, you can ask us. So let's go through the next two slides. Yeah, keep going. There we go. So today we're asking for your help to reach out to your legislator to co-sponsor HG 1130. To find your legislator, you can go to the Massachusetts legislative website and determine who if you don't know already, who your legislator, your senator or rep is. The State House number is 617-722-2000, and that will connect you to your legislator's office. So when you're calling, we ask you, to say where you're calling from and in what capacity. And then also the purpose of your call, that you're wanting to improve the quality of support and services for yourself or a loved one. And you can use the script that we have that's currently on our website for our action alert for the workforce bill. But basically we want co-sponsors for HG 1130, and we want to increase in wages for direct support workers. So again, we want you to tell your legislator why you want a qualified and reliable workforce. You can ask them about what their stand is on HG 1130. If they have any questions about it, you can thank them for their time. And then, which is really important, is that to follow up. So we know that this is a really short turnaround for a deadline on getting co-sponsors today. So if they're not able to become a co-sponsor today, we do ask that you ask them to publicly support the bill and reach out to the relevant committee that the bill is put on, and then also to leadership and follow up with them, whether they, to make sure that they do this, and then if you can, report back to the ARC. All right, so tips for writing and emailing your legislator. So again, we have an action alert that's up on our website that you can use and shoot out an email today. You can also create your own email. By the way, we've had 272 emails sent to legislators since last week when we put up the action alert, which is great. So thank you all who have already done that. It's amazing. If you want to draft your own email or letter, Just make sure we have all this information, your name, address, phone number, email, what you're writing about. You want to recruit and retain a qualified workforce. It's great to add a personal story or picture. Be sure to mention HD 1130, asking for support, or if you have time today, co-sponsor. And then you can always provide more information. If you're emailing, writing a letter, you can include the ARC fact sheet. And then, of course, thank them. Next slide. How are we doing on timer?
Good. We're good.
Okay. So for tips with meeting with your legislator, we don't have to go through all the different, what you need to do. You can check in with the ARC if you need help in planning or scheduling a meeting or finding resources from us. But this is an ongoing campaign, so it's going to take more than one legislative session, most likely. So we really need your persistence in keeping the issue a priority for legislators. So meeting with them is a great way to do that. And of course, sharing your story is the most important thing you can do. And with connecting your story with your request and your ask for support of the bill. So using media, again, it's very important. You can write a letter. This is a long-term campaign, so using the media is a really great resource to have. You can do a letter to the editor. Responding to an article or a topic that's in media can be a really great way to reach a lot of different readers and showcase this important issue. And please feel free to reach out to Leo or me or Maura or Charlie about doing this if you're interested in writing a letter to the editor. And sharing your personal story. I mean, I know we constantly ask you to share your story, but this is really important. It makes a huge difference. The legislature needs to know why this is an important issue to you, whether you don't have services and you need them, or you're dealing with staff turnover, which is, and having unreliable services, or you want to talk about how great your DSP is, and it's made such a huge impact on your family's life, and you don't know what you would do if you didn't have that person helping. Those are all really important stories, and we want to be able to share them not only with the legislature, but also with the media, because we do often get requests for stories and contacts from the media, and be really great to be able to showcase all your important stories on this issue. And then, so finally, we thank you so much for joining us today and your commitment to the workforce campaign. It's essential that we have your help to advocate and to try to accomplish all of our goals together. We encourage you to visit our workforce webpage to get updated on our workforce campaign, which that's the link to workforce. And so I think that's it. Here's our contact information. And if you have any questions, we can go over that.
Well, thank you, Ellen and Leo, for that update on the workforce. And I just was going to let people know if they have any questions, just to chat them in the chat pane, and we can answer them for you.
Well, you all do that. I was just going to add one more thing. As Ellen said, this is a long-term campaign because we're not going to get everything in one session. But even in this session, it's a multi-step campaign. So as Ellen mentioned, the committees, we're not sure which committee the bill will first go to. We'll go to 2 committees even, where it affects Mass Health and the Department of Governmental Services. We'll then go to a 3rd committee after that. So each of those times, your participation through a letter to the editor, helping people around you be aware, reaching out to your legislator or legislator on the committee that might be in a neighboring town, neighboring district, all of that will make a difference. And the more unified we are, the better it is as well.
All right. Any questions from folks? Okay, I think we just got one.
Right. So I got a good question. I see it about the rate. And you know what? We looked at the language. I think it's pretty clear, the language, that rate setting, it requires the rates to be set by the secretary and, or the commissioner that are marketplace rates. And that automatically means that will happen. However, Ellen and I talked about this today. As the bill goes to committee, we're going to talk it over with someone else, one of our colleagues at Law Center, and see if we might want to have some adjustments in the language. There's no question about that. But yes, that is the whole point of the process, given that we would use Chapter 257 as the mechanism for the rates to be increased. How will this affect the state budget? Wow, well, a lot. And that's a very technical term, a lot. Yeah, it's a significant lift. I would think cross human services, we're talking about $500 million altogether in the end, on the long run, because you have the direct workforce. You want to make it equivalent to healthcare and education sectors, as Ellen commented. And then you want to take care of the salaries above, people with experience, and you want to have enough clinical supports. We didn't get into that today because we're focusing on the main number one. So we want DSPs to have the right kind of clinical supports. So yeah, I would say it's in that it's in a healthy neighborhood, and that's why everyone's got to be in on it together.
Right, and that's why we do need the secretary or the administration to look into having that long-term plan, and that's the kind of thing that they're going to be looking at, the impact on the budget, because we can't really come up with the numbers. And we talked about a little bit about the amount of savings for turnover, but yeah, that's something that has to be dealt into by the administration.
And that's why it's a multi-year fix through that group as well. They'll suggest maybe a 4-year, 5-year window steps.
And do you see the question from Ann? Do you have projections on what's needed workforce-wise?
Right. So we'd have no way of the specific projections, because we're talking about personal care attendants, we're about adult family care, we're talking about day habilitation services, we're talking about adult day health, we're talking about mental health, the Department of Developmental Services. So it would take each state agency to document their numbers and then do some projections. And again, you can't hear? How about, is that better? Hello? Is that better? Okay. So basically, we need each state agency to document the impact on its area, because this is cross-human services. And we went cross-human services because in meeting with different policymakers, their feeling was that was probably the sensible way to go, since, basically we wouldn't want to have a situation where one agency benefited and another agency didn't.
Are there certain regions of the state that are lacking? I mean, I think that we've gotten support across the state. I think this is a problem that a lot of families across the state, and as well as provider agencies, are feeling right now. So I don't think there's a region. I mean, so we have a list of the 70 legislators that you can check on the website to see whether or not your rep or your senator is co-sponsor of the bill, and that's a better way of gauging. But I think we've got a pretty good mix right now.
I mean, what's key though, I think, let me take what you didn't ask, which is we're going to need people across the state to continue to press that button, continue to reach out, or else people will think, oh, okay, this was just a flurry, and it's not a big deal, And so I would say, every region of the state has to be in on this. We can let you know probably in a month. I think people, we're going to stay on top of every region. We don't think this is the kind of thing that's going to pass unless there's across the state support. And yes, to the follow-up question, $500 million is across all agencies. Okay, I think we're good.
So did you, did you see Ann's question? So the $500 million is across agencies?
Yeah, I thought I said yes. It's across all of human services.
Right.
Yes.
Okay, it really is. I just think that they will see bottom line and not repercussions if not done.
Well, I think that's why we need to all be unified. That's a lot of money. So if we don't,
But I
but
mean,
we're also
again,
saying, yeah, go ahead.
it's a long-term investment, and we know this is only going to get worse, and that's what we need to continue to relay, is that this is not going to get better without intervention by the administration and the legislature. I mean, this has to be dealt with. This is a problem that all of human resources providers are experiencing, and so and this is an urgent thing that needs to happen now.
So, and also, Ellen, you mentioned about the planning committee. There's an opportunity to sort of plan this
Right.
out, get full legislative support. No one wants to be alone on this thing. It's a big lift. And I think that's why we're saying we want this committee, right, to bring in stakeholders. So, and
Yeah, that's a part of the planning process,
yeah.
is having committees.
Yeah.
And there was a question about where's the fact sheet on our website?
So if you go back a slide
Yeah.
and go back to the web page, it lists, sorry, if you go back one more slide, that's on the ARC website. It's on our website. So we have two fact sheets, one that's specifically for the bill, like most fact sheets that we have at the ARC that focus on just the bill. That's one fact sheet. And then we have a longer fact sheet that goes on and talks about all the different issues facing the workforce. But both of them are on the webpage. And then we'll put up this PowerPoint, and then we'll have we have our proposal, we have other materials on that workforce page as well.
So, and I'm going to encourage, like, again, Ellen's contact information is there. Charlie Fisk is at fisk@arcmass.org, FISKE, and Morris Sullivan. Encourage you to contact the three of them. And we will also have regular updates so that if people want to get coached, and we'll also be out in the field. So we want to work with you. And I know the affiliates see this as a big priority, as well as so the chapters of the ARC across the state. Cindy Howard's on today's call, but I know Dan Burke made it a priority in South Norfolk at his Wednesday night meeting. I know across the state this is a big deal, as well as other agencies such as the Price Center and folks Grow in Randolph. Across the state, people are concerned about it. Bay Cove, you name it. Everyone's concerned about this. So we'll be continuing to have, update webinars, whether we do them twice a month or what makes sense. We'll do them.
And then we'll also have through our notes,
Yeah.
we'll give updates on what's happening.
Through notes from the ARC. For those of you that haven't subscribed, probably everyone on this is, but it just go and subscribe on our homepage. All right, Carrie, I think we're good.
All righty. Well, thank you again for everyone who joined us today. In the next few days, you will all get a copy of the presentation and also a link to the recording as we put it up on our YouTube channel. And I want to thank our presenters today, Leo and Ellen, and thank all of you. And at the end, you're going to be rerouted to a brief survey, if you wouldn't mind completing it and giving us any suggestions on how we can make this series better. So everybody have a great day, and we'll see you soon. Bye.